Good afternoon, sir. Good afternoon, classmates. Um, Today we will going to report about Chapter 6, Puberty. But before that, let me introduce first myself. My name is Marilor Julia Purina, together with my group mates, Miss Paraguso Nika, Katrina Damiar, Maybelline Palomera, and Mr. Rustico Sanogan. And without further ado, let's start our topic, which is puberty. Now, what is puberty? Puberty or sexual maturation is the transition period that takes a person from being a sexually immature child to a sexually mature, reproductively fertile adult. No, it includes internal and external changes during the maturation of primary and secondary sexual characteristics. So, in this stage, diri nagsugod ang tanan, diri nagsugod ang pagtubo, we start feeling maka nanay ka create ng other through the presence of bacteria, and there's a lot of mga oily, diba? And then to continue, adolescence development refers to the psychosocial, cognitive, emotional, and behavioral changes that accompany an anatomical and physiological alterations during puberty. Next is the word puberty. Has its root in the Latin word pubes, which means hair. Pubescence is the state of the child between the oneself of pubertal changes and the completion of sexual maturation. Much is known about timing of the biological events during puberty, yet no typical pattern exists. Now, to continue, as we can see in table 6.1, typical sequences of events during puberty in a female and male. So let's start with female. By the age of 9, female growth spurt begins. Initial increase in height and fat deposition. And by the age of 10, the female initially breast development, pelvis widens, pubic hair begins to appear. And by the age of 11, female maturation and growth of internal reproductive organs, ovaries, oviducts, uterus, vagina, maturation of external genitalia, areola becomes pigmented. So by the age of 12, the female feeling of breast, menarche, axillary hair appears. So by this stage, the female starts to show menstruation. And by the age of 13, first ovulation occurs. Skeletal growth rate declines, breast maturation complete. Sweet and sebaceous gland development, sometimes with acne. By the age of 14, female voice deepens slightly. And by the age of 15, adult stature reach. So, while in male, by the age of 9, initial stages of spermatogenesis, Leydig cell appear and begin to secrete androgens. And by the age of 10, subcutaneous fat deposition increase, testes begin to enlarge. Sugod na siya dako. By the age of 11, increase in scrotum and penis size, increase in spontaneous erection frequency, first sign of pubic hair, growth of seminal vesicle and prostate gland, skeletal growth spurt begins. So, sugod na pagtubo ang mga buhok. So, by the age of 12, male pubic hair more apparent, nocturnal emission begin. So, kabalo ang mga boys ana. By the age of 13, larynx grow and deepening of voice occur. Hair appears in axilla and an upper lip. May tubo-tubo ng mga buhok sa ilang sa ilang bangas. Then, by the age of 14, first fertile ejaculation, slight breast enlargement in some individuals. Natubuan na sila tutoy. Then by the age of 15, adult hair pattern including indentation in front hairline and appearance of chest hair, sweat, and sebaceous glands develop, often with acne, loss of body fat occurs. And by the age of 16, broadening of shoulders, muscles growth, and increased muscle strength. And by the age of 17, male adult stature reach now or later. Next is pubertal changes in females. So a female first ovulation can be at the time of menarche, but usually in some months or as much as 2 years or after menarche, the first menstrual cycle in pubertal female thus are often anovulatory and fertile. So menarche and first ovulation are only steps in a series of changes in pubescent female. So diri na nagsugod no na females pag na sila nagregla. Although for a pubescent female, the first menstrual flow is a memorable event and is often used to mark puberty. It occurs rather late in the pubertal sequence. Metabolic rate, the rate at which tissue uses oxygen, heart rate, and blood pressure, increase in females at puberty. The first external change during female puberty is usually growth of breast tissue. The onset of breast growth is called the RHK or breast budding. Next topic will be discussed by Miss Katrina Damiar.
Everyone, so for table 6.3, which is pubertal development of certain anatomical features in females and males by Tanner stage. For females, maybe they encounter changes, pubic hair and breast. For stage 1, pre-pubertal, also for breast, or which is before puberty. Stage 2, sparse slightly pigmented straight medial border of labia. So diri nga part dili pa kadaghan ang mga buhok-buhok nga gapang tubo. For breast and papilla are nipple elevated, a small mound, areolar diameter increase. So ang areolar is kanang dark part sa imong tutoy, kana siya di kanang murag increase na siya mura na siya gadako. For stage 3, for pubic hair darker, beginning to curl, increase amount, diri siya is sugod na siya og kulot o gadaghan na siya. For breast areola enlarged to contour separation. For stage 4, curly, abundant but amount less than in adult. So gadaghan na siya, tas kulot na jud siya. Breast areola and papilla from secondary mound. Stage 5, adult feminine triangle spread to medial surface of the tights. So ang mga pubic hair is maabot na siya sa paa. Then ang breast, mature nipple projects areola part of the general breast contour. For males, they may be encountering changes in pubic hair, penis, and testes. For stage 1, pre-pubertal, also for penis and testes, which is before puberty. Stage 2, scanty, long, slightly pigmented. For penis, slight enlargement. Testes, enlarged scrotum textures altered. Stage 3, for pubic hair, darker, starts to curl, small amount, so diri kasugod na siya og kulot. Tas gamay pa siya, di pa kay siya daghan. For penis longer. So yung penis daw boys, gadako. Also for testes. Stage 4, resembles adult type but less in quantity, curly, penis, larger glands, breadth increase, thin is larger, so also gadako siya. For stage 5, adult distribution, spread the medial surface of the thighs. So same for the girls, kadaghan po siya sa, maabot siya sa medyo sa maabot siya sa paa. Sa paa lagi. For finished adult, so yeah, dako na siya. This also. Next one is pubertal changes in males. So, mga changes sa mga males. In males, pubertal changes include growth and maturation of the testes and male sex accessory structure. So, for boys, ang inyong mga changes is ang inyong maturation sa iyang testes. Male secondary sexual characters begins to appear. So, diri nga part is kapanubo na inyong mga hair, pubic hair, sa mga any part sa inyong kuan, sa inyong body, gatubo na ang mga hair. Example sa face, bangas, tas ang ilok pod nanay buhok, tas ang inyong mga sani extremities part sa inyong mga kamot na napoy mga balahibo or mga buhok-buhok. Tas ang inyong maka-experience sad mong mga odors na napod may mga simhutan na napoy mga manggawas nga baho, especially sa ilok, that is caused by bacteria also. For skin naman is kanang gatubuan na og mga pimples, pero I think depende man guro na sa inyong kaliwat, dili man guro na di kuan sa kay kanang hilig ka magkaon og mani, magka-pimples na ka, siguro is nana na siya sa blood na nimo nga bugas-bugason ka. Even mga tigulang nga bugas-bugason man gyapon. So also pod ang tingog pod sa voice sa mga lalaki mabag-o. So magtingog binata na sila. Then another is the scrotum and penis of pubescent males grow markedly. Spontaneous erection which occurs in infants and even in male females increase frequency during puberty. So next one is nocturnal emission, which is also known as wet dreams, begins in pubescent males. This emission tends to occur during sleep or night after waking up. So boys, this is for you. This is wet dreams. Kabalo na mo unsa nang wet dreams. Initial ejaculation of pubescent males during nocturnal emission, masturbation, or cutis are relatively sperm-free, but not possibility always exists that at least some fertile sperm are present. Both spontaneous erection and nocturnal emission tend to decrease in frequency after puberty. Next one is gonadal changes from birth to puberty. For male, the example is testes, and for women is ovary. So for women, ovarian changes. The ovarian of a newborn female are about 2 centimeters in length, and each ovary contains about 500,000 ovarian follicles. Follicles is a small sac of fluid in the ovarian that contains a developing egg. So ang follicles is nag-contain siya og mga egg cells sa mga babae nga which is nga develop na siya. Most of the oocytes are contained in primordial follicles, but several are in growing follicles. 60% of the newborn ovaries contain some tertiary follicles. By 1 year of age, the ovaries of all females contain tertiary follicles. No follicles ovulate during childhood, but many growing follicles become cystic or atrophic. For males, which is testicular changes, seminiferous tubules in the testes of a newborn male contain only spermatogonia and Sertoli cells. Some Leydig cells are present at birth. Leydig cells is a interstitial cells located adjacent to the seminiferous tubules in the testes. The next topic will be conducted by Maybelline Palomera.
Good afternoon, everyone. Cryptorchidistis, the process of spermatogenesis requires temperature of 3.1 degrees Celsius or 5.6 Fahrenheit, lower than that in the abdominal cavity. If spermatogenesis begins while the testes remain in the body cavity, temperature damage occurs in this crypt orchid testes, or crypt meaning hidden, orchid meaning testes. Only Sertoli and Leydig cells remain. Cryptorchid testes are often treated. Negative feedback reactivates the hypothalamus and pituitary. Negative feedback reactivates the hypothalamus and pituitary. So ang proseso sa spermatogenesis is kinahanglan jud nga naa siya'y temperature nga 3.1 degrees Celsius or 5.6 Fahrenheit. Next is hormones in females. In estrogens is response to rising gonadotropin levels. Estrogens or estradiol and estrone begin to rise in pubescent female, causing the onset of breast maturation, and they continue to increase as female approaches menarche. So kuan siya, ang estrogen kay start siya rise kung ang babae kay gasugod na pod siya og taas. Hinungdan nga magsugod na pod og increase or pagdako ang atong or inyuhang mga dughan. Next is estrone is produced by body fat. Estrogens is initiate development of mammary glands, cause growth of body pelvis, and help deposit subcutaneous fat. These steroid hormones also cause growth and development of the external genitalia and of the vagina, oviduct, and uterus. So ang estrogen is produced by body fat because magsugod siya og develop sa mammary glands og body pelvis nga ma-help siya sa to deposit subcutaneous fats, and ang mga steroid hormones pod is kay gakos pod siya og growth development sa ato ang vagina, oviduct, and uterus. Androgens, levels of androstenedione and dihydroepiandrosterone also increase in the blood of pubescent female, but the ovary is not the main source of these so-called weak androgens. The adrenal glands secrete large quantities of these hormones during puberty. And adrenal androgens are responsible for some of the changes in the female during sexual maturation, including the growth of pubic and axillary hair, slight lowering of the voice, development of sebaceous glands and acne and growth of long bones. So, ang anginal is kuan siya, responsible siya sa pagbag-o sa mga babae during sexual maturation. Apil na diya ang hair axillary, slightly lowering of voice and sebaceous glands and acne ug ang pagdako pod sa atong mga bones or kabukugan. Next is menarche and first ovulation. As gonadotropin levels increase during puberty, rising estradiol levels induce thickening of the endometrial lining. Fluctuating gonadotropin secretion may not be sufficient to cause ovulation, but it does cause enough cyclic variation in ovarian estrogen production so that menstruation occurs. Thus, as mentioned earlier, the initial menstrual cycle of pubescent females are often anovulatory. Eventually, the endocrine system and brain matures so that the LH surge is sufficient to cause first ovulation. So, ang menarche is mo-increase siya during puberty or pagbibinata sa mga lalaki na siya.
Hello, good afternoon everyone. My topic is hormone levels in males. Gonadotropins and androgens. It means testicular androgens along with adrenal androgens cause growth of sex, accessory structures, seminal vesicles, prostate glands, penis, scrotum, and the secondary sexual characteristics, pubic, axillary, and facial hair, larynx growth. Gonadotropins means any hormones that stimulate the gonads or sex glands to carry out their reproductive or endocrine functions. In males, these glands are the testes, and in females, the ovaries. Testosterone causes retentions of nitrogen, calcium, and phosphorus in the body, thus supporting the bones and muscles growth seen in sexually maturing males. Spontaneous erections become more frequent as puberty approaches due to the effects of androgens on growth and touch sensitivity of the penis and on the male sex drives. Estrogens. Blood estrogens levels also rise slightly in males before and during puberty. The source of these estrogens is probably the sterilized cells of the testes. The presence of estrogens in male near puberty explains why some pubertal males exhibit slight growth of the mammary glands, gynecomastia. Gynecomastia means that is a condition of overdevelopment or enlargement of breast tissues in men or boys. Androgens and acne. Rising androgens levels during puberty in both male and females increase the secretions of the skin sebaceous glands. These glands, which normally secrete an oval substance termed sebum, can become clogged and infected with bacteria producing acne like pimples, blackheads, and cysts on the face, chest, or back. So, halos sa mga adolescents kay naay mga acne. Usually, it clears up in a few years and beyond can have acne. sa mga young people na experience nila as kita young people na experience nato ni na kondisyon og ang uban ani kay ga-suffer, gakaulaw o gakawad-an sila og self-confidence. Contrary to the popular belief, if acne is not caused by improper hygiene, long hair, or ordinary stress, nor is there are any scientific evidence that any specific food causes acne. Some treatments used to alleviate acne include antibiotics and medications containing benzoylperoxides, salicylic acids, or sulfur. What mechanism cause puberty? The pubertal changes in secondary sex characteristics such as breast development, fat depositions, development of the genitalia, changes in the larynx, and the body hair growth, result from increasing levels of gonadal steroids. 6 steroids levels in turn are influenced by rising gonadotropins. So, ang adolescence kay ga-change siya in secondary sexual characteristics such as breast development, fat deposition, genital development, throat changes, and body hair growth tungod sa pag-increase sa levels of gonadal steroids. In turn, 6 steroid levels are affected by elevated gonadotropins. Environmental factors and puberty. Environmental factors that influence the physiology of the child can also affect the timing of sexual maturations and puberty. Of the many possible factors, nutrition, day length, stress climate, and social interactions are examined. So, ang environmental factors di kay gaka-affect ni siya sa mga bata o gaka-affect po ni siya sa sexual maturity and puberty. So, mao to ang mga rasons, factors, nutrition, day length, stress climate, and social interactions were examined. Nutrition. What is the possible of the decline in the age of female puberty? Some evidence shows that improved nutrition and health in childhood are factors. Females in countries with poor nutrition tend to exhibit a relatively delayed puberty. In fact, acute starvation prevents puberty. Also, poor nutrition in rural compared with urban region in lower social classes and in larger families may account for the later age of puberty seen in these groups. So, unsa daw mga rason nga nung ga-decline in female in puberty age? So, mo ni ang mga evidence or suggestions that improving children nutrition and health kay isa sa mga hinungdan. And also, isa pa sa hinungdan ang women with a poor nutrition kay ga-delayed siya sa puberty. Acute hunger ang acute hunger also can prevent a puberty. Day length and season means the light dark cycles through their influence on pineal glands functions play a role in the onset of puberty in humans. Has the artificial increase in day length in recent years as a result of increased use of artificial lightning been at least partially responsible for the recent decline in the age of puberty. The next reporter is Mr. Rustico Sanugan.
So, padayon ta sa atong topic karon. So, atong topic is stressor A stressor is any set of circumstances that disturbs the normal homeostasis in the body. Stress, however, is the physiological effect of a stressor. Any kinds of long-term stressors produces a set of physiological stress responses that Hans Selye has termed the general adaptation syndrome. There's some information, however, that stressors, emotional or physical, can delay puberty in humans. Evidence also exists that stress during infancy and childhood can accelerate puberty. Stressors means that things happen in yourself that make you stressed. Example of this is loss of job, increase in financial obligations, emotional problems, lots of activity, or anything that make you stressed. Environmental pollutions. Environmental pollutions of the chemical used in the synthesis of plastic and other industrial processes act as a weak estrogen. Some biologists hypothesize that exposure of children to this widespread xenoestrogen may accelerate puberty. In overweight children, the weak estrogen synthesized by adipose tissue may add the estrogen load. The next is genetic and puberty. Genetic and age of puberty. Genetic factors interacts with environmental factors to determine the age of sexual maturation. In fact, the differences in age of menarche among different countries may be related to genetic difference in populations as well as to difference in childhood health and nutrition. So, mao na siya gitawagan genetic and age of puberty. So, next is puberty and psychosocial adjustment. Young people must adjust to remarkable physiological and anatomical and psychological transformation during the process of puberty. Their body changes rapidly. Ang imong body is kanang paspas ayang pag-change there sa puberty and psychosocial adjustment. Thus their body image how they perceive their peers. Similarly, and male may worry about the size of his penis. So, mo ni gakapil sa mga lalaki, guys, diri sa puberty and psychosocial adjustment. If these are not within the norms, he may feel that something is wrong with him. Young people should realize that there is considerable variations in the timing of the stage of puberty among different individuals and that most people develop into normal adults in the course of their sexual and physical maturations. So, mo ni kahitabo diri sa puberty and psychosocial adjustment.